The thought that, controlling end-of-life symptoms was something, so simple was just key to me about using it. I just knew there was a better way. Nurses would be in the home for 2-3 hours trying to control symptoms and maybe not controlling them in the end. Okay, what can we do? These things aren't working. The PO meds aren't working. The sublingual meds aren't working. And, we'd increase the doses at first and that was not working. So I said, okay, well, let's try a Macy Catheter. And the more the nurses used the Macy Catheter, the more they realized that it really was effective. They can control symptoms in 15 minutes. It's so much better for the rest of their day. If we couldn't control end-of-life symptoms in the home, we pretty much would send the patient to the hospital for GIP, which is general inpatient, mainly for symptom control. Let's say we had to send an ambulance to pick up the patient, $403, which is one way. Then we had to send them back home, another $403. A lot of patients before the Mace catheter, we had to send to the hospital for symptom control. And then they would die in the hospital. I mean, that's not what hospice is about. Hospice is keeping the patient home and keeping them comfortable in the home. Nobody would be able to come in and see them, which was devastating. I mean, the families were just really devastated. We have team leads in our office that take the calls from patients, and I have noticed a decrease in the amount of time that one nurse is on the phone dealing with symptoms that are out of control. We don't get as many calls after the Macy catheter's in, and so that's less nurse visits. The nurses are teaching the caregiver how to use the catheter, so that has been huge in the amount of time that we're saving. Get my doctorate, DNP, and the project I chose was to increase the use of the Macy catheter for end-of-life symptoms. I have to tell you, I was so excited to see the goal was met 100% of the time, that we controlled the pain for the patient. The same thing with anxiety and agitation. It was 100%. Shortness of breath was way up there as well. All those scores before I had done my project were quite a bit less. So that was pretty cool to see.